Life with Timber is amazing. She's a wonderful dog. Every morning we have a routine. We get up, we go for a walk in the morning. After work, it's tug of war until I'm tired, not her.
We discovered there was a problem with Timber. I had taken her to the dog park one day and noticed that she was limping. We took her to our family doc, who took an x-ray and said, I think it's arthritis, but I can't rule out bone cancer, so we want you to go and get it checked out.
When we first saw Timber in March of 2009, I actually wasn't completely sure that it was bone cancer either. The x-rays did not have a classic appearance of bone cancer, but we took the steps to verify and had an MRI performed on the affected area and confirmed, unfortunately, that yes, indeed, it was very suspicious for bone cancer. A biopsy was done, and that is how we confirmed bone cancer, also known as osteosarcoma.
We cried.
Yeah.
We cried and cried and cried. But then we also made a very quick decision to be positive. We really believe that Timber feeds off of our energy, and at that point we decided that we were going to do everything we could to allow her to live as long as she was ready to do so.
Bone cancer is unfortunately very common in dogs in Colorado. This is a state where people love big dogs. We hike with them, we're very outdoorsy, we see a lot of big dogs, and unfortunately, large breed dogs are at risk for bone cancer. Pet owners worry about the diagnosis of bone cancer because it means amputation of the affected limb. And there's always this uncertainty as to how their pet will do on 3 legs. Fortunately, most dogs rise to the occasion and do very well on 3 legs, and we've certainly seen that with Timber.
Almost immediately after Timber's diagnosis, we had her scheduled for the amputation.
Timber handled the amputation very well. The first day we picked her up, she was very tired, but the minute we got her home, she was out in the backyard, walking around with some of our assistants, but getting around rather well considering that she had just had a major surgery.
Chemotherapy is typically initiated 2 weeks after surgery to give the pet time to heal from the amputation, give the wound time to heal, allow the pet owner also to know that their pet's doing very well. We'll start chemotherapy, and it's generally a series of 4 to 6 administrations of chemotherapy, and fortunately most patients do very well.
As far as her tolerating the chemo, I tell you, they were outpatient procedures, so we're here for an hour or two and would bring her home, and she acted like there was nothing bothering her at all. I mean, she really just did well with it.
For anyone who gets a diagnosis that, your dog has cancer, you feel almost hopeless and you don't know if there's anything you can do, and really you have options. Again, the goal is quality of life. That's why we do this, and fortunately, most patients do very, very well.
Yeah, Life with Timber is fantastic. I couldn't be more proud of how well she's recovered and done since all of her treatments, and she's just a happy, happy dog.